Another day, another topic. 9 popular ways to treat erectile dysfunction. The number of men diagnosed with erectile dysfunction has skyrocketed ever since the little blue pill made it okay to talk about. Fortunately, the number of treatment options has increased, too. Viagra, Levitra, and Cialis. For many of the 30 million Americans affected by erectile dysfunction, Viagra, Levitra, and Cialis are the first line of ED treatment, and they're successful for about 80% of men. These drugs, called phosphodiesterase 5 inhibitors, are approved by the U.S. Food and Drug Administration, FDA, and work by increasing blood flow to an erection. Common side effects include nasal congestion and headache. Penile injections. Alprostadil is an FDA-approved erectile dysfunction drug that can be injected directly into the penis to trigger an automatic erection. Penile injection is the most effective type of ED treatment for men who can't take oral treatment, says Nelson Bennett, MD, a urologist at the Leahy Clinic in Burlington, Mass. Possible side effects include a burning sensation and priapism, an erection that lasts more than 4 hours and requires medical treatment. Muse. For men who are unwilling or unable to self-inject alprostadil, the FDA has approved this dissolvable pellet that can be inserted directly into the urethra, the opening of the penis, says Dr. Filoni. Using Muse to treat ED can result in somewhat unpleasant side effects, however, including an aching sensation, burning, redness, and minor bleeding. Vacuum pump. Can't or don't want to take ED drugs. The vacuum pump method is the next most common choice among men with erectile dysfunction who pass on pills, says Dr. Bennett. To create an erection, you place a plastic cylinder over the penis and pump the air out of the cylinder to force blood to flow into the penis. An elastic ring that you slide onto the base of your penis holds the erection. Side effects include numbness, bruising, and weak ejaculation, and the ring must be removed after 30 minutes. Surgical implants. If you have a neurological disorder or spinal cord injury and other erectile dysfunction treatments aren't effective, 2 types of surgical implants could offer solutions to your ED. An implantable pump can be used to manually create an erection by pumping fluid into cylinders placed inside the penis, explains Filoni. Risks for these ED treatments include infection and mechanical breakdown. Sex therapy. The best way to treat erectile dysfunction caused by performance anxiety, depression, a poor relationship, or stress may be with a combination of ED drug treatment and sex therapy, individual therapy, or couples therapy from sexual health professionals. Male hormone therapy. Male hormone is not an approved treatment for erectile dysfunction, notes Bennett. It may be used to increase desire in men who have low testosterone, but it doesn't improve blood flow to an erection. Also, testosterone drugs should not be used by men with prostate cancer. Side effects include acne, breast enlargement, prostate enlargement, and fluid retention. Herbal supplements. Herbal supplements such as ginkgo biloba, saw palmetto, and yahimbe have been touted as sexual enhancers, and some men have been tempted to try them to treat erectile dysfunction. Shock wave therapy. The idea of using low-energy shock waves to treat erectile dysfunction comes from studies that show that these types of shocks help heart blood vessels regrow, a process called revascularization. Shock wave therapy may also work on the penis, and there have been some promising results, but it's not currently an approved ED treatment. The future of ED treatment. The next new treatments for erectile dysfunction will probably be improvements in some ED drugs already being used. And newer phosphodiesterase inhibitors that last even longer and cause fewer side effects are being developed.